eat with the hand, I eat with fork and
But you
knife.
see, it's difficult to clean it if you cannot put it out.
Yeah, but I'm willing to go to one place and say, okay, you take out everything, you clean like every 6 months, you know, but feeling comfortable, it's really the, the best thing, you know. It's like, okay, it become a part of me. Honestly, I can tell you, I like a lot this kind of, I felt really comfortable, okay? It would be really perfect.
Okay.
Even if I need every 6
So
months
it's not
to...
disturbing you that your tongue,
Mhm.
it has not enough place.
No, because as I told you, I already adapted.
Okay.
For instance, when I use that kind of the denture in Portugal,
Mhm.
no, that one, that you
That one.
have here,
This one.
okay? When I use these, I also adapt my mouth
Okay.
from...
But it's, you can make it very smooth.
Yeah,
Maybe
yeah,
they
yeah.
did not do it nice.
But when I was using it after, let's say, after two weeks, I adapt myself to that. When I changed to this one, I needed extra, let's say, 1 week. But after that week, I can tell you, it really felt like, okay, it's really adapted to me.
Mm.
Okay, I was feeling comfortable eating, and as I told you, I cut everything very small.
Mm.
But I do it since I was a kid, even with when I had no problems with my gums, because my big problem went when I got an infection that affects a few of my gums, okay, and some teeth began to falling. Okay, and afterwards the option that the doctor told me, well, you have a few gums away, okay, it will be better for you that you wear a prosthesis. And I say, okay, I will wear a prosthesis. One dentist in Portugal, when I was there, told me that this firma worked with some material from Switzerland.
Mhm.
I don't know, as I told
So
you.
you
the name-
pay everything in
Yeah.
advance, and you say it was 14,000 euro.
Yeah,
So if everything would work in time, in like planned,
hmm
there would not be any kind of bill left. It was
no, it was totally
totally
paid, yeah,
totally paid.
totally paid.
But now you get only this provisorium, this the work we use only in temporary time, so that's why it was broken, because
Mhm.
it's only made from plastic.
Yeah, that's, I know that it's not as strong,
The laboratory was
Mhm.
going bankrupt.
yeah.
Yeah.
It was on May 2024, I believe.
Oh, so long,
Yeah,
2
yeah,
years.
2 years already, yeah.
Mm.
I believe it makes no sense. I have the implants already in my mouth.
Yeah.
But because I have no information about the implants, that for everything that I need to do, I need to make new implants, new surgery, new everything. And I think, well, when I went to Portugal, at least one person told me, I know that the implants are from, I believe they said something from Switzerland, maybe not everything, okay, because I know that there are several...
No, it's only these parts. They
Yeah.
are maybe from Straumann. We have to check.
Mm-hmm,
I will give you company to visit the doctor,
mm-hmm,
that we can talk 3 people together,
okay.
because the doctor is not making these dentures, it's the
Mhm.
dentist. So we will find a solution.
Okay. After I make that decision of making implanted teeth or an implanted denture, I say, okay, I'm going there and I'll make it. The firm seemed 20 years in the market, so it wasn't one place that opened 6 months ago, okay? And I was, okay, let me do there. Of course, that when 2 years ago it went bankrupt, for me it was really hard. Hard because, as I told you, it was really ending. The process was literally ending. And so I got nothing rather than these implants that were not definitive.
So, but in the dental clinic, they don't want to help you?
In university?
Yeah.
No.
No. So in the university, they told you they don't have a screwdriver for these standard screws.
Yeah.
So they could not help you.
Yeah. And I
This
told
is ridiculous.
with even with the doctor that was in the first doctor, he could not use nothing that I have, and that what really honestly upset me. He could not use anything that I have, and if I need to do like another one, I need to take these implants, put new implants, and have another surgery. And honestly, if you can imagine, it's painful, only for one day, of course,
Yes.
but it's still painful. And of course, you still cannot work for, I would say, like 1 week. It becomes complicated. So that's why when they told me that I could not use anything from there. I have to make a new surgery. I have to make new everything. I was okay. But regarding to the prosthesis, she's not feeling very comfortable, and she would say, "Go talk with someone from Gilsburg also that works with prosthesis." And okay, then I come here, of course.
But we have to find a doctor. I will give you company.
Okay.
And we see the doctor, he makes x-ray and we find out if this really is implant from Switzerland. And then if we have it, we can continue working it.
Okay.
Okay.
Okay, it will be good.
Now it's only, I make the repair. It's not broken again. But it will not fix nice.
Yeah. No, and to fix I need to screw it.
I close with wax.
Here.
That it's not going too much bacteria inside.
Okay.
And what I can see, where the implants they're sitting, it's not the right place they have to be. You can even see here, one it's coming here out, one it's coming here out, only one it's in the nice direction. So I'm not sure if it will make you happy.
Me neither. I know that, there was 4, right?
Yes.
There was missing one
yes.
here.
Yes, it was the one who was breaking.
Yeah.
So I was not putting it back because I will make it loose.
Okay, you will.
Now it's stronger if I don't use it because it will also not be fixed.
Okay.
We have to find a dentist who make the x-ray that we can check if they're strong, because one it's really outside of your bone. It's not sitting on the bone.
That when I was when I was making the surgery and putting the implants, I believe that's the one that got, I will say, broken. I believe that one was in a place that I have not as much bone that was needed.
Yes.
So in order for him to implant, he told me that he changed a little bit the angle of the.
But it costs a lot of money and it will not give the nice result. The position of the implants are on the wrong place, so if you're talking, your tongue has not enough space.
When we will be able to meet this doctor?
I can phone today. It's Saturday. I will phone on Monday because now it's Easter time. I'm not sure.
Yeah, for me it is next week. I will be awake. It will be also
maybe we can change information by email. Thank you.
Thank
we will find a solution.
Okay, thank you.